Can everyone hear me? I'm Crystal. I'm here to call an end to the rumors. It is so very true. It is reality. Despite our self-preserving need to turn a blind eye, the mental health system of British Columbia needs your help. And it is on that note that I welcome you all here to connect as a community to propel a very important conversation around mental health and suicide crisis care in BC, with a shared understanding that every person and their story weaves in and out of a collective net. I am so grateful to see you here and to feel your support. Thank you for taking the time to come together. We have called this event here as a way to connect and advocate for changes in mental health and suicide crisis care. It is my hope that the messages from Cindy Zimmer, Alphonse Beer, Ella Hale, Eleanor Sturko, and Adam Olson help to inspire the forward movement of this conversation, not only here today, but that it is carried with you in the spaces and communities you connect with when we part ways. I stand before you without knowing your stories. I can only truly know and share my own. But before I do that, I want to acknowledge this building behind me. I consider that just as we have our own stories, we all have different views and perceptions of what this building represents. From where I stand today, I see the shore, where my ancestors sailed in and stole this land from the Lekwungen people, known today as the Esquimalt and Songhees nations. The lives of the Lekwungen people stood here connected and in place long before these stones were laid. Before I speak of the trauma that my own privileged family experienced this year, I first want to acknowledge that this mental health event that you have all gathered here for today is taking place on stolen land, and that the displacement that was caused by colonization brought generations of trauma to a people deeply anchored by connection. Connection to each other and connection to the land. A connection much deeper than the anchors that held those ships to the shore. I am aware, as I stand here today, I am an uninvited body standing and breathing in this space. While I do not have the power to change the past or make bills pass in the building behind me, I am committed to learning and growing as a stranger to Turtle Island. I am always honored to connect with and learn from those who rightfully have their roots and spirits embedded deep within this land, and I will do my best to advocate for and activate reconciliation. My sister and I are here today to share a story with you that we know by heart and that we carry with us everywhere we go. It is one that has fueled our determination to bring about change. It is a story about how our beloved brother, who despite asking for help, plummeted through the crack in our current Mental Health Act. The last day I saw my brother, I hugged him so tight in front of the hospital doors. I wanted to trust that the professionals inside knew what they were doing. I wanted to tell my inner deep-rooted connection with my brother to be quiet. I told myself, shh, you're just his little sister. You are not the people inside the building who are trained to know better. So trust that they know better. We trust the teachers, the school administration, and the safeguards in place to protect our children. We trust the long-term care facilities to keep our elderly relatives safe. We trust because we're told to trust, assured that systems are in place to ensure their well-being. We are told that we do not know better. But I ask you today, how can we trust a system that sends a vulnerable man out the door without access to counseling, takes him off his medication, and sends him away from his connections, his supports, and his family? My brother James knew they had made a mistake. He was scared, and he confided that in me. But it didn't matter. His care plan, or lack thereof, was decided on by professionals who claim that they know exactly how someone needs to be cared for, as though they've known them their whole lives, yet they don't really know them at all. How could they? As family, we are made to believe we are not allowed to know when our loved ones need us. According to the Mental Health Act, the healthcare team are not allowed to inform family when someone in active suicide crisis is shown the door with nothing more than a card for the crisis line and an outpatient referral. Yet the healthcare team actually does know better. For the most part, the people working on the front lines do really want to help people, and many of them do see that family and personal advocates play an important role in the connection and protection of safe discharge planning and suicide prevention. But from what I hear and have seen, their hands are tied. I've been dreaming of a mountain to scream from since my brother died by suicide. I have been trying to make sense of the glaring negligence and lack of accountability that others, like my brother and our family, experienced. It is clear that mistakes were made. But we teach our children to learn from mistakes. So I ask Minister Jennifer Whiteside and Minister Adrian Dix, how have your ministries learned from my brother's death? What are you going to do to ensure that the deaths of James Zimmer, Aaron Sanyo, Glenn Fox, Nicole Chan, Eddie Young, and the countless others are not setting BC standards for suicide crisis care? These losses should be a devastating exception and not the rule. That crap has got to go. I want to know what the government of BC plans to do to make this better. I can't get my brother back, but I can stand up and demand better for all of you. I can demand better for my children and even myself. I want improved mental health and suicide crisis care support in BC, and I won't stop advocating for it until changes are not only designed and implemented, but until there is proof of positive outcomes. I want everyone here to know that their story matters and their voices need to be heard. We invite you to send a message about your story and the ways in which you believe the Ministry of Mental Health and Addictions and the Ministry of Health can repair the crack. There are postcards and pens on the table here for you to use to send your message. So please make sure to share your thoughts, and we will personally make sure that your messages are heard. Thank you. I would now like to introduce you to a woman who stands by those she loves with unwavering loyalty and support, my best friend and big sister, Cindy Zimmer.
Thank you, Crystal. I want to thank you all from the bottom of my heart. You have all made the choice to connect with your community. You are all showing each other courage by being here today. Talking about mental health is not easy. This takes vulnerability, which we all know is not comfortable. I can tell you, talking about suicide is something that I'm not comfortable with. And yet but I'm here to do that because I need to. 2 weeks ago, I took the Applied Suicide Intervention Skills Training course through the Canadian Mental Health Association that is presented by the Centre for Suicide Prevention. If I had only taken this training sooner, I would have been more informed and prepared to support my brother James. I would have had some tools and strategies that I could have used while supporting him during his suicide crisis. But I didn't know. I hope someday soon the ASSIST training will be as recognized as having a first aid certification. Providing this support is critical to save lives. In the course, they talked a lot about connection and how important it is to identify a person of support, whether this is a friend, family member, or anyone in that person's life that can show up for them. We need to support and protect one another. We all have a part in making things better. That is why we need to voice our concerns. We need to voice our concerns when things are not working. I'm here today to use my voice. I have immense concerns. My family and I will forever be affected by this crap. My brother James fell through the day that they let him walk out of the doors of the Royal Jubilee Hospital Psychiatric Emergency Services operated by Island Health. They discharged him without the connection and protection that he needed in his most vulnerable time imaginable. This was a choice they made. Not reaching out to his family's support to ensure he had someone in his court. This past February, I brought James into the hospital to seek help as he was actively suicidal. This was a very urgent situation as I saw it. I felt the right thing to do was connecting him with the helpers. I bridged him to the professional support. I sat with my brother that night as he expressed to the attending doctor his very clear and immediate plans to end his life. My brother James had given his consent for me to be informed prior to his discharge, but that did not happen. Total devastation. I am still in disbelief. We asked for answers through the Patient Care Quality Office, as this is the process they tell you to go through when you or your loved one has or has not received the quality of care that was expected. We had a meeting with the Director of Psychiatry and the Clinical Director of Mental Health at Royal Jubilee. It was clear that they were not going to engage in any conversation of accountability or transparency. They did express that this meeting was only going to be a high-level summary, but more facts would be in the medical records. Surprising to us that they felt at high level the number of beer he drank before coming into the ER that night. And yet, they could not directly answer our questions around if it was reported that James had expressed his clear plan to end his life. They wouldn't tell me if it was reported that James consented for me to receive a call prior to his discharge. It was said to us that they followed what was laid out by the Mental Health Act, the BC Mental Health Act, and hospital policies. Clinical decisions made by hospital physicians for his assessments was untouchable during this meeting. I want to ask you, where is the accountability in that? Not for a minute do I believe that James wanted this outcome for himself. Not for a minute could I have ever imagined that they would not have bridged him back to me. He was vulnerable, and they knew I was his support network. James, he had so much to live for. A skilled Red Seal carpenter, excellent guitar player, had a family who loved him and who he loved. Nieces and nephews he adored and protected. His fur baby Pearl was everything to him. James had dreams. He spoke of wanting to become a peer supporter. The help was just not there. Total disconnection. My brother James died by suicide within hours of walking out of the Royal Jubilee Emergency Mental Health Services door, where he had willingly gone for help. I believe this could have had a different outcome if he was supported with person-centered care. He needed support to develop and action a safety plan that went beyond just a referral and a pamphlet for the need crisis line. Humanity and empathy is required. If they had listened, they would have heard him express that he was not feeling safe and that he had lost his value. People need more than 10 minutes with a psychiatrist with a prescription pad. Treatment for co-occurring disorders, mental illness, and addictions needs to be available to British Columbians now in real time, and not only available if you can afford it. It's time to look at what is happening in this current system. It's time to learn from the past by hearing from British Columbians. I truly hope that heartbreaking stories like James, Aaron, Todd, Glenn, Eddie, and Nicole have all not been lost for nothing, but maybe to teach us all about how we need to show up and support individuals during suicide crisis. I ask the government, what would you expect or accept for your loved ones or even yourselves? I want to ask Adrian Dix, our Minister of Mental Health, and Jennifer Whiteside, Minister of Mental Health and Addictions, what is being done to fix this crap? Are you willing to hear us and value these lives enough to collaborate with British Columbians? We need you to be the leaders you have set out to be by actioning urgent changes that are needed. We can all do better to make human connections within this community. This is something that is a responsibility we can all commit to. This doesn't require fancy education, it requires humanity. When in doubt, check it out. Pick up the phone and call someone. Show up and hold some space. Can we honestly say you're not alone? We should all connect to protect. Maybe this is all it could have taken, a phone call. That phone call could have created a safety net over this crack for James. So in my search, you know, you kind of you're looking for answers, you're trying to figure out, like, how do I make sense of any of this? And so I went searching, you know, online, which is not always a good thing to do, but I came across a letter. There was a mandate letter that I found online. It was written actually from Premier David Eby, and it was addressed to Honourable Jennifer Whiteside back this past December. And you know, if anybody wants to view it, you can just, you know, you can just see it online. There's a copy right here. But there's one thing that I wanted to point out from this letter that really struck me. There's a spot here that says, I expect you to prioritize making progress in the following: expand new complex care, treatment, recovery, detox, and aftercare facilities across the province, while building a new model of treatment, offering seamless care through detox, treatment, and supportive housing for people, so people don't fall through the cracks and can make quality care and get quality care when and where they need it. So they're aware of the cracks. I know that nothing can bring James back, but knowing how strongly he had felt about safety and protection, he would not want this to happen to anyone else. I want to believe our leaders have good intentions and they are trying to do the right thing. It's not enough. They don't have the full picture. They need our help. We are sending out an SOS. Messages for change. In this bottle. Use your voice. This is a distress call. Blow the whistle. Sound the horn.
Hello, my name is Alphonse Fear, and I'd like to thank Cindy and Crystal for having me play here today, and also to share with you my thoughts on this issue. I also am my brother committed suicide in 2001, so I am also due to mental health issues, and so I have a personally affected by also what people are going through. Yeah, I'd just like to start here. On the healthcare system that is in place to help people with mental health issues is broken. Broken on the inside and the outside. Inside, there needs to be new solutions and options for patients that are admitted and treated in our institutions. For families and friends on the outside, we need more access to facilities and secure and open dialogue with members treating our loved ones. My brother, like I said, took his own life in 2001 after a long battle with mental illness. During the most difficult times, my parents were left on their own to cope with the struggles. I was living in Toronto and did not understand the severity of the situation. When I did see him on my visits to Victoria, I was shocked at how different he was compared to when we were growing up. During that time, he was in and out of the hospital and other institutions that follow rules and privacy guidelines. While he was admitted, he was administered drugs, and I believe he was left isolated. There is a lack of compassion in our system. Alternate treatments are needed that are more holistic and healthier. My wife is a hypnotherapist, and she sees clients that have been through our healthcare system. They come in broken and in distress. I understand that hospitals are understaffed, and I understand the difficulty they have. But there should be people they should give time to sit with these patients and hear their story, and I think that would make a big difference. Our time is now to incorporate and offer new methods of healing. Drug treatment does help, but it's only for a temporary fix. How are we going to get to the root of the problem? How are we going to make change? Well, we're coming together today to this event, hopefully to bridge the gap, to make more connections with our communities and the healthcare system. Start the dialogue and make the necessary changes so no one else falls through the cracks. Thank you.
Hi, I'm Ella Hale. Standing up here today and speaking beside courageous voices like Cindy and Crystal is an honor. I wanted to share a story with everyone, a story of this individual. This is 17-year-old me. This is the person who reached out for help and was told that it was just hormones, that she would be fine at 25, and that if she killed herself, her dad wouldn't care. This story begins when she was 12, when I first learned the challenges of navigating the mental health system. 3 years later, at 15, I would see suicide as the only way to feel better. Some high schoolers were planning what they were going to wear to their next party, and I was planning how I could kill myself without harming those around me. Much to my surprise, that wasn't possible. According to the World Health Organization, for every person that dies by suicide, another 10 people will be deeply affected. Those are that person's family, friends, colleagues, classmates, people who had no idea the devastating impacts of suicide until they were forced to deal with the consequences. Consequences that are often a result of individuals falling through the cracks of the system. That means for the 600 suicides British Columbia has on average each year, another 6,000 people will be deeply impacted. Those 6,000 people only reflect those that were impacted by a death. It does not reflect the individuals who endured severe trauma at the hands of a broken system, who reached out for help and were left more hopeless. The families who are left scrambling after a loved one tried to take their own life because the pain was insufferable. It does not reflect me. When I was at my lowest and thought I couldn't go on any further, I did. I was able to because the resilience and the kindness displayed around me. Kindness that looked like a healthcare aide holding my hand and talking to me in the ER. Kindness that specific psychiatrist showed when he decided my mom deserved to be kept in the loop of my care. Kindness that social worker showed when she told me I was going to make a difference in my future and to just hold on. Those people, though, are becoming the exception, not the expectation. Mental health professionals are failing patients and their families because the policies and legislation around mental health are failing them. Politicians are left pointing the finger at a broken system, meanwhile they are the ones in a position to do something about it. Families are now grieving the death of a loved one, wondering how they could have worked the system. You shouldn't have to work the system. The system should work to benefit all British Columbians and their families seeking mental health care. It shouldn't be a gamble on whether or not you get adequate care. It should be an expectation that when you show up and scream, "I need help," your hand is grabbed and you are told, "I got you." As I stand here today and look behind me, I'm overwhelmed with the realization that mental health reform is not a priority inside of that building. I know firsthand the impact of suicide, but for some reason unknown to me, someone dying is not enough for measurable change to occur. What more do we need to do to prove that the system is not working for anyone involved? Patients, family, mental health professionals? How many more people must we lose before they say enough is enough and focus their efforts into changing how mental health care is treated in our province? Before the Mental Health Act is reformed? Before there is a real continuum of care? Before there is a real standard of care? Before families are involved in all steps? Before legal documents are filled out 100% of the time? Before individuals on all levels are being held accountable? Before wait lists are not a year long? Before mental health patients are treated as people and not as problems? We need a holistic view of mental health, which is not possible within the current restraints of our Mental Health Act. I challenge those inside of that building to reflect upon how it might feel to go through a system not set up to support you. How it must feel to be constantly told, "Reach out for help," and when you do, nobody is there to catch you. How it might feel to be grieving the death of someone you know could have been here today if only. If only they made a phone call. If only they believed him when he said he was going to take his life. I'm not surprised that after all this advocacy work, these are still the conversations we are having. I realize that these conversations will continue so long as we keep viewing mental health and suicide as an individual, isolated problem rather than a systemic failure not being prioritized inside of our province. I don't want to have these same conversations in 10 years. I don't want to read Instagram comments on high schoolers' posts who took their own lives. I don't want to become a statistic. I don't want to see the future generation go through the same problems I did. So for the future generation, for the current generation, for literally everyone, do something. And if the individuals inside of that building, in a position of power to do something, will not do anything, then we all have a duty to stand up, stand around, and to support each other. We are not creatures meant to do stuff alone. So let's rally together. Let's help each other. Let's hold each other. Let's cry with each other. Let's heal with each other. Let's recover with each other. Thank you.
Hello, my name is Eleanor Sturko. I'm the MLA for Surrey South, and I'm the critic, member of the opposition, the critic for mental health and addictions. I'm really pleased to be here today. I first met Crystal and Cindy through email, when they contacted my office for advocacy, and I heard their story about their dear brother James. Unfortunately, it was not the first time I had heard a similar story of people that were discharged from services in our province only to either self-harm or to die by suicide. I was also a police officer for 14 years before I became an MLA, and my primary reason to take on this challenge, this role, was because I had also witnessed these types of events occurring throughout my entire career as a police officer, people who I had myself taken in a mental health crisis to the hospital who did not receive the care that they needed. There are people on this table that you see before you that I tried to help in my career, but unfortunately they're not here today because of this crack. That's why I joined the Legislative Assembly, and that's why I'm here supporting Connect to Protect, because we do have work to do. It's time for us to put the care back in healthcare. And it's time for us to recognize that mental health is healthcare, and that it should be on equal footing, and that it's a huge, tremendous part of our whole of body wellness. And that without mental health, really, we don't have health. Earlier this year, I introduced a private member's bill that will increase the ability for doctors to share collateral information with families. So that means when someone is brought into the hospital and they're in a mental health crisis, maybe it's a person they just met 5 minutes ago. But before they make a decision whether to keep that person in care or to discharge them, that they should contact a near relative where appropriate and get some more insight on what's happening with that person. Because we believe that families do know what is happening with their loved one. They do have information that can help save a life. So far, this government has not called my private member's bill for debate, and I think that's a shame. Because I can see from all of you here today and listening to the stories that were shared with us that being able to collaborate with families, being able to have safety plans that include families that are ready to fill this crack, that are there wanting to support their loved ones and be a part of a safety plan, is a crucial part of helping people be well in British Columbia. So I'm really proud to be here with this group today. I'm so happy to see such a great crowd of supporters here. I'm happy to stand by my colleague in the legislature, Adam Olson. We're not from the same party, but we both have a deep personal care for mental health issues, the issue of suicide. And when it comes to caring for people in our province, especially the most vulnerable, especially the ones that need our help the most because they don't have the ability to help themselves in a moment of crisis, it's nonpartisan. We agree that we have to do something to help repair this crack. So thank you for including me today. Thank you for listening. Please do fill out the cards. Write to your MLA, regardless of what party they're in. Write to your health authorities and let them know that you would support legislation that would help include families and help them help their loved ones. Thank you.
Thank you, Eleanor. Thank you, Crystal and Cindy, Ella, for your powerful words and for your courage to stand in front of this building and to share your experience. In question period today, we asked the Minister of Health whether he was prepared to make changes to the Mental Health Act. And he committed that changes were already happening. Unfortunately, that message is not getting to psychiatric emergency services as they continue to deliver the type of care that has clearly let so many families down. This is the project to shine a light on the impact that has or psychiatric emergency services had on people throughout this region. It started years ago, and yet it continues. We request meetings with the administrators of the program to get an update, and they're just continuing to turn over new people every time. seemingly impossible to pin down exactly what changes are happening. And yet the minister stands today and commits that the changes are underway. We've offered to remove this from question period. We've said, look, just work with us. Just work with, have the three parties sit and work collaboratively on this issue. And we were denied our request to do so. And so we're left very little other options other than to stand in question period and raise these in the public sphere rather than addressing these really important policy issues collaboratively. This government made the decision that they're going to do this on their own. And yet we continue to see that they have not delivered the results that British Columbians, that people in this region deserve. And so it does take the effort to stand on the front steps of the legislature to point out the crack in the system that people are falling through, the lives that have been lost unnecessarily and prematurely, the impact that this has on families. And I'll just reiterate, and I think I can do this, that we remain committed to working with this government. I didn't check with Eleanor before, that's why. We remain committed to working on this issue collaboratively. We remain committed to the handout that we extended to say this is not a partisan issue. This is an issue that all British Columbians should be working on together to improve the services to help support the ones that in our families that need that support, and to ensure that families can be a part of the support team for their loved ones. Finally, I just want to raise my hands to the people who work in our offices, who hear these stories and who work with the families on a regular basis. These are traumatic stories. They're traumatic stories to share. There's traumatic experiences to live, and they're traumatic experiences to hear. And unfortunately, the volume of these stories continues to increase. And the impact that has on the people working on the front lines who are trying to support family members in the best way possible. And so it's not just that this government needs to act on behalf of the families who've been let down. This government needs to act on behalf of the people who are working on the front lines, who want to see those changes so that they don't have to sit and continue listening to the stories, the tragic stories that continue to happen. So I just want to raise my hands to everybody that's here today. I want to raise my hands to you for being courageous and sharing your stories. This is how change happens. Events like this are how we raise awareness, and the Ministers of Health has committed to meeting with Cindy. Did you hear that? And Crystal, who wants to hear your story directly. So maybe if the minister's staff are here, you can take the family up and they can have that conversation. Because he needs to hear directly from the families who've been directly affected. So with that, I raise my hands to you, High School CM. Thank you. Thank you, Eleanor, for being so open to working collaboratively. Thank you for your work.
Thank you so much, Adam and Eleanor, for supporting us from the minute we started working toward finding answers. We've had such support from both of you, and we're fumbling and very sad, but you've both just really been there for us. And Jerem, you too. Ella, thank you so much. And Alphonse, thank you so much for playing for us and sharing your words with us today. It really meant a lot to have you.